concerns that people come to you with questions
for? Definitely. I mean, Botox has been used in the medical arena for 32 years. It's used to treat migraines. It's used to treat all sorts of medical conditions. The use of Botox in its diluted form for cosmetic treatments was discovered purely by accident. In America, there's a doctor called Dr. Jean Caruthers, and she's married to her husband, Dr. Caruthers, who's actually a dermatologist. Now, she was an ophthalmic, an eye doctor, and she was using the botulinum or the Botox to treat a patient who had a blepharospasm, which basically means a blinking eye. Right. So the patient's treated successfully, but the patient says, Dr. Caruthers, can we keep up the treatment, because I've noticed a great side effect. I have no lines on my face. Yeah. So she went home to her dermatologist husband and said, listen, I'm just noticing that they started tests. Now, the Dr. Caruthers in America, this couple, are the people who are accredited with bringing Botox to the market for cosmetic use. It's been around, it's 32 years, it might be even 33 this year, so it's well established within the medical arena. The thing to do is to be using the Allergan Botox. You know, there's no point in using other brands that aren't approved and that aren't for use within the medical arena.
And are there side effects? I mean, are there bad stories that
Of course there are side effects. I think the key thing is, you know, if you want to have a Botox treatment, you can go to somebody who does it every day, all day. But not obviously on a Sunday, but pretty much all day, every day. Or you could go to maybe a salon who has a visiting doctor every 6 or 8 weeks. I wouldn't suggest the latter. I think you need to be going to someone who does this all day, every day, as opposed to somebody who does a little bit of it on the side of maybe a general practice or something like that. Okay. So I think it's very much operator dependent. Obviously the risks are, you know, you're having injections, bruising, swelling. You've seen our last patient. People are walking out here, not a marker in their face. And that's what you want. You want an experienced injector, gentle treatment, no marks on the face. The other myth is the drooping eyebrow, the drooping eyelid. That comes from people having, you know, from injections putting Botox in the wrong area. Botox is for treatment of the glabellar area and up through frontalis muscle. You know, if you have it obviously below the eyebrow, of course you get a drooping eyebrow, but anyone who's experienced
this... So the message is go to the right person.
Go to the right person, and be careful who you go to. Make sure that they're established and they know what they're doing, obviously.
Now we have the lovely Maria with us today.
Hi.
Tell me, from your own perspective, is this something that you've thought about for a long time? Because we're going to be doing the Botox treatment on you, or Dr. Marr will be doing it.
Yeah.
You know, why do you want to get Botox now?
I think because I don't like the frown lines that I have here, and I've thought about it. Not really thought about it. I was more afraid of coming to Danielle. I was more afraid of coming because I'm afraid of injections, but I've reassured that it doesn't hurt.
And we did a little work on Maria about 4 weeks ago. Maria, if we could just take off your glasses, Pat. Thank you so much. We did work on Maria 4 weeks ago, and we did the orbicularis oculi, the muscle at the side of the eye. So if you want to just turn to the side there, you can see very well there's no lines here. So obviously Maria's had a treatment. It was her first time coming to have that treatment. You know, we said, look, let's just do a little bit so that you're used to it and you become accustomed to it, because obviously first time it's better, less is more. And Maria's so happy with that, both the result and obviously you were confident in the fact that it didn't hurt. Didn't hurt.
So we're back for more.
Back for more.
What do you think of people's perceptions here in Ireland of Botox? I mean, is it something that you would discuss with your friends and say, you know, I have had this treatment?
I would discuss it. A lot of my friends do it, but don't discuss it. They don't talk about it. It's kind of very secretive. They do it, but they don't talk about it. But I can kind of see now when I look at my friends. I know who's done it. I know. I see the difference. Sure.
So Maria, if you just wouldn't mind raising your eyebrows for me, that's great. Okay, and relax. So obviously when Maria is nice and relaxed, you can see there's still the 2 vertical lines here, or rhytids, which are very common in everybody past the age of 32, 35. These are created from excessive squinting and frowning. So we want to relax these out. Obviously there's a few additional lines here across the forehead, horizontal rhytids, and we'll also treat those as well. When you're having the treatment, it's really important that you stay relaxed, because the muscles are more comfortable being injected into. They prefer if they're relaxed, and it's a more comfortable treatment. But really, there isn't much to it. You can see even from Maria, there's not a huge amount of flinching or jumping or anything else. It just is what it is. It's just a little pinch, that's all. With Maria, we're going to go for a little bit of a brow lift. Obviously, with Mantox or with male Botox patients, we keep it very flat through the forehead. With women, we have the beautiful, the thing that we can do that really is an added benefit and a beautiful bonus is we can create a little bit of lift in the eyebrow. So, for example, as we age, the collagen, the elastin reduces, and we can have a little bit of excess skin here. So, by creating a little bit of a natural brow lift by using the product, we can create more space in the socket for you to work with your makeup. And again, just a little bit of a raised eyebrow is a more youthful look.
that literally was very, very, very fast. How long will that treatment last on a patient?
Well, this is Maria's first treatment, so probably she'll get about 4.5, 5 months from this treatment. You'd hope that in time she'll get 6 months out of each treatment. And again, it'll take 3 to 14 days to kick in, and then it'll last for
And I suppose the big thing is, people at home are saying, yeah, but that's just so expensive.
Well, I suppose, you know, treatments for treating the forehead area can start from €250, anywhere up to €550. The old adage, you get what you pay for, definitely applies. It's your face. You know, you need to be having Allergan Botox, you need to have a good operator. And again, sometimes it's not so much here that we would necessarily charge any more than anywhere else. It could be just maybe that you might wait a little bit longer for a treatment slot or for a consultation. But I think it's really important that you research who you're going to, and just make sure that obviously you're happy. And if you go in for the consultation and you're not happy, just go out and go to the next place.
And obviously you're the patient. Yeah. How did that feel? I mean, is it a pinching feeling, or do you feel the needle going in?
It's a slight little pinch, but as I said before, I was terrified. I'm terrified of injections. I mean, I could come here every day now. It's great, and I have to say, Dr. Meagher is very gentle, very gentle.
That's very good. Well, listen, thank you very much, and hopefully we'll see you very soon.
Absolutely.
Now, with children spending a lot more time on the internet, it's only natural that their parents would worry, and especially with a lot of the stories in the media nowadays about the likes of cyberbullying. Well, there's a new software system, I hope I'm saying that right,